we will describe the scapular motions of the scapula. The first one we will go over is upward or lateral rotation of the scapula. Upward or lateral rotation of the scapula will occur on the sagittal axis along the frontal plane. So on the scapula, the axis of rotation is about right here, and on a 2D diagram, the sagittal axis will come right towards you. So on our chopstick model here, the chopstick is the sagittal axis, but with the rotation of the scapula is moving along the frontal or the coronal plane. So remember, sagittal axis moving along the frontal or coronal plane. So for our upward and lateral rotation, the inferior angle of the scapula will move laterally, and this makes the glenoid cavity move cranially. So once again, on our model, the glenoid cavity will move cranially, and at the same time, the inferior angle is moving laterally. The muscles associated with upward or lateral rotation include the trapezius, the upper fibers and the lower fibers, and the serratus anterior. The upper trapezius attaches to the lateral clavicle, which is not drawn here, but we will draw it here anyways, and it'll help pull in the cranial or superior direction. The lower trapezius attaches to the triangle at the base of the spine, and it will pull in an inferior or caudal direction. The serratus anterior attaches to the medial border of the scapula on the anterior side, and it'll help pull in the lateral direction. So with these three muscles, it'll help complete upward rotation or lateral rotation. The next scapular motion is downward or medial rotation. So downward or medial rotation occurs on the sagittal axis along the frontal plane. The center of rotation on the scapula is about here, and the sagittal axis will come right out towards you. So on our chopstick model here, the chopstick, shown like this, is our sagittal axis. But with the twisting of the sagittal axis, the scapula is moving along the frontal plane. So for downward and medial rotation of the scapula, the inferior angle will move medially, which causes the glenoid cavity to move caudally. So once again, the downward or medial rotation of the scapula involves the inferior angle moving medially and the glenoid cavity moving caudally along the sagittal axis. The muscles involved with downward or medial rotation of the scapula include levator scapula, both rhomboids major and minor, latissimus dorsi, and pectoralis minor. So the pec minor attaches to the coracoid process of the scapula and will help pull in a caudal direction. The rhomboids are along the medial aspect of the scapula, will help pull in the the medial direction. The levator scapula is along here and will help pull in a medial and superior direction. The latissimus dorsi attaches to the intertubercular sulcus on the anterior side of the humerus, which is poorly drawn here, and will help pull in that direction. So all of these muscles will help the scapula rotate along the sagittal axis to complete downward or medial rotation. During anterior tilt along the coronal or frontal axis, the inferior angle moves posteriorly and cranially. So posterior and cranial, but it might be easier to see from this direction. That anterior tilt causes it to move posterior and cranial. Anterior tilt causes the coracoid process to move anteriorly and a little bit caudally or inferiorly. The only muscle involved in anterior tilt is pectoralis minor. Since the pectoralis minor is attached to the coracoid process, and the coracoid process moves anterior and caudally, thus it pulls the scapula into anterior tilt. Scapular elevation travels along the coronal plane and just glides superiorly or cranially. Some sources say that elevation also involves upward rotation, and some other sources say elevation involves anterior tilt. So depending on which source you look at, we'll have the scapula always gliding superiorly, but there might be some anterior tilt, there might be some upward rotation. The main muscles involved in elevation are levator scapula and the upper trapezius. So the levator scapula is along the medial superior part of the scapula and will pull superiorly. The upper trapezius attaches to the lateral part of the clavicle and will also help to pull superiorly and possibly some anterior tilt as well. Scapular depression involves the scapula gliding inferiorly or caudally. So our scapula will just travel in a downward direction and it will glide inferiorly along the thorax. The muscles involved in scapular depression include pectoralis minor, latissimus dorsi, the lower trapezius, and the subclavius. The subclavius, as the name sounds, is subclavicle. So the clavicle is here and it will pull in an inferior direction. The pec minor attaches to the coracoid and will also pull in a downward manner. Latissimus dorsi is on the humerus anterior side on the bicipital groove or intertubercular sulcus, and it'll help pull in a downward direction. And the lower trapezius attaches at the triangle of the base of the spine and will pull in an inferior direction. These muscles help with scapular depression with the inferior glide. The scapular motion of protraction involves abduction, abduction, lateral or upward rotation, anterior tilt, and elevation. So on our 2D model, protraction will have the combination of abduction, lateral or upward rotation, where the glenoid cavity goes cranially and the inferior angle goes laterally, elevation, where it slides superiorly, and anterior tilt, where it tilts anteriorly. So on our scapula, protraction is a combination of abduction, lateral upward rotation, elevation, and anterior tilt. So together, on our pumpkin model, Our protraction will be the combination of abduction, lateral or upward rotation, anterior tilt, and elevation. So the combination of those actions will result in protraction. From this angle, it will be protraction. For another visual demonstrating protraction, here is a model from the Complete Anatomy app. The muscles involved in scapular protraction are pectoralis major and minor and serratus anterior. So pectoralis minor attaches to the coracoid process and will pull in an inferior direction to cause that anterior tilt. Pec major attaches to the lateral lip of the bicipital groove on the humerus and will help also with that anterior tilt and rotation. Serratus anterior is on the anterior side of the scapula along the entire medial border. The serratus anterior will help with the abduction and the rotation to perform protraction. The scapular motion of retraction is also a little complicated. It involves adduction, medial rotation, and possibly elevation or depression. So for scapular retraction, it will perform adduction and medial or downward rotation. On our pumpkin model, retraction involves adduction and medial or downward rotation, retraction. From a side view, it will be adduction and medial or downward rotation. For another visual of retraction, here is a model from the Complete Anatomy app. The muscles involved in scapular retraction include middle trapezius, which attaches to the spine of the scapula to help pull in that direction. The rhomboids, both major and minor, and the levator scap. All three of these muscles line the medial aspect of the scapula, help pulling it medially. And then the latissimus dorsi, that attaches to the bicipital groove on the anterior side of the humerus. Help pull it in the medial or downward rotation direction. Together, these muscles complete retraction.